industry. During today's healthcare forum, we will discuss two very important and vast topics that are top of mind within healthcare: elder care and mental health. The experts you will hear from today are incredibly knowledgeable on these important topics and have the understanding and experience to help and advise the Long Island community. Before we dive into today's program, I'd first like to recognize our sponsors who support this important event and made today possible. Our presenting sponsor is Catholic Health. Now, let's hear a little bit more about Catholic Health before we start.
At Catholic Health, when we see our island, we see extraordinary life. The most extraordinary of which is you. It's because our Catholic faith places the highest value on people, all people. It's the inspiration for our exceptional medical care with unmatched compassion. And it's why at Catholic Health, you're more than a patient. You're someone's family, best friend, and a neighbor to us all. Long live Long Island.
Thank you, Catholic Health. I would now like to also thank our advocate sponsor, Kona Elder Law, PLLC. Now it's time for our first panel discussion, which will have a strong focus on the future of elder care on Long Island. The experts I'm about to introduce will share key insights on the transformation and future of elder care. Our distinguished panel includes Jennifer B. Kona, founder and Kim Kranz, President, Home Care and Good Shepherd Hospice for Catholic Health, and last but certainly not least, Ashley Petito, Director of Social Services for Jefferson's Ferry Life Plan Community. The moderator for this panel will be myself, yours truly, Regina Jankowski, editor of Long Island Business News. Welcome, everyone, and I'm so happy to have you join us today. It's great to be here. So before we get into our discussion, I always like to do a few little housekeeping notes so everyone who is watching today can follow with the flow and they know how to participate, and we welcome participation with questions at the end. Our discussion here is going to be about 45 minutes, and if you have questions, which we hope you will, please hold them to the end of our panel session, as we've set aside about 10 minutes for questions. If you have a question, please type it in the chat area that's on your screen, and that's so I can ensure that I get to it and I can address it during the Q&A portion at the end. So let's get started. So before I dive into our questions, I just wanted to kind of set the stage about what we're going to be talking about today. And I know this is a very important topic that I think anyone who's logged on to this session can appreciate and understand, especially as the Long Island region's population is aging. So I have some statistics here that were provided by Catholic Health, and Long Island's segment of seniors age 65 and over is presently about 586,000, or about 20% of our bi-county population, so Nassau and Suffolk counties. And this is expected to increase by 3% in the next 5 years. So it's only going to get more and increase higher. So with all that being said, I'm going to stop talking, and I'd like to jump in and start with Jennifer Kona of Kona Elder Law on really how someone is thinking of long-term planning, how they should start. So specifically, Jennifer, when is the ideal time to start planning with an elder law attorney, and how should you address if you've missed out on that ideal window?
Well, good morning, Regina. Thank you for having me. It's great to be here with this really esteemed group of colleagues. It's great to see everybody. So the best time to start with an elder law attorney is before a crisis hits. So easier said than done, of course, because no one knows when there could be that healthcare crisis. We don't have a crystal ball, at least I don't. If anybody does, I would love to borrow it from you. So really, the earlier, the better. And so for a lot of people, that means maybe planning when they're thinking about retiring, or if there's a healthcare issue, either that someone has had or a family history of that, then you might want to plan earlier than that. And what the planning really involves is asset protection planning, estate planning, setting up your will, your trust, things like that. And it is different for everybody. So what I see in my practice is that people will come in with a preconceived notion of what they need based on what another family member did or a neighbor did or something like that, but that may not be right for them. And of course, they also have an idea from Mr. Google, which is the worst thing people should be doing when it comes to anything law related or
Yes.
related for that matter. Don't Google things because you can just go down this rabbit hole that may be completely inappropriate for your needs. So you really need to sit down with someone and find out what is best for you and kind of leave your thoughts at the door and get guidance specific to your needs. But the earlier, the better. That leaves all your options open for your care needs, whether that is going to be home care, nursing home care, assisted living. We all want to have those options open and available to us. And as we know on Long Island, those are very expensive needs. So being able to finance those needs is really, really important. And most of us do not want to be a burden on the family, last I checked. So keeping those options open is super, super important. So what happens if you haven't planned ahead, to the second part of your question? There is what we call crisis planning. So let's say mom's going to a nursing home, didn't do any planning. We are luckily able to do last minute planning where a person can save 1/2 of their assets. It's a very specific kind of planning. It has to be done exactly, precisely. And it is very much the devil's in the details. So you have to make sure that you are with a practitioner who knows exactly what they're doing and does this often. But at least I would like the viewers to know that not all is lost. Something can be done. And if it's a married couple, we in New York still have spousal refusal. So assets can be transferred in an exempt fashion between spouses. The spouse now with all the money can sign a spousal refusal saying they're not making assets available to the spouse who needs care, and that spouse can go on Medicaid benefits, and the spouse who is well can hang on to all of their assets. There's a little more details to that, of course, that we probably don't have time to go into, but that is still available in New York State. We have very generous benefits here in New York State, including home care benefits, which we'll probably hear about from Kim. So we are very lucky in New York.
Well, that's great. Thank you for sharing that. I know there's a lot of people probably that, they, like you were saying, there's no one size fits all solution when it comes to like, oh, well, this is what my brother did. I'm glad that you mentioned Google, because I do know people that Google that question about, and this is it's a very sensitive topic, and it might be a topic that people, you have to have those tough conversations. So, so moving along, I know, Jennifer, you had mentioned home care and assisted living as some of the things that obviously come up when speaking to an elder law attorney. So we have Ashley Petito here from Jefferson's Ferry, who I know can speak to that. So welcome. And my first question is, I'm sure there's a lot of these conversations that happen why it's important for an elderly person who still wants to have a sense of independence, whether they are aging in place or in an adult community. I know that's when is the right time for some to move mom or dad or grandma or grandpa into, an assisted living or a place where they can have 24-hour care. So if you can address that, that would be great.
Absolutely. Thank you for having me. I'm so glad to be here. I think it's essential for us to maintain our independence as we age, whether we're aging in place or we're moving into a community like Jefferson Ferry. We spend so much of our life being in control of our own decisions and what we do or don't do, that it can be very demoralizing as we get older to feel like we've had that taken away from us. And that's one of the nice things about the variety of options we have, especially if you do the planning ahead of time and not in that crisis situation, because it really gives you the opportunity to make those decisions without some of the emotions that can go with it. I think it's so important to continue encouraging that sense of independence, even when we move into a facility, because it helps to maintain and sometimes even improve someone's quality of life. allowing them to do things that they can still do, whether it's with modifications or, within the safe confines of a facility or with home health present, can also help retain our functioning and our mental well-being for much longer than if we just take over and do everything for that person. By focusing on the strengths, we let the person maintain some of that control in an area where they safely can. I use the example with a lot of families often about, maintaining your home and your personal well-being. While I might not be able to, as I age, keep my house clean and stay on top of all the tasks, can I hire someone to help me with that and maintain some of that control? Or if I can't shower independently, but I can still dress myself, we have this, staff or whoever's working with them, encourage them to dress themselves as independently as possible to maintain that mobility, to maintain that sense of dignity, and that sense of self that we work so hard to achieve throughout our life. And it can also, in areas where there's cognitive impairment or some kind of dementia present, can also help to lessen some of those conflicts and the aggression or agitation that we might see from people by, allowing as much independence as possible.
No, that's interesting you say that, Ashley, because I know when my grandmother, when we had to move her to an assisted living facility maybe about 10 years ago, that was one of the things that she still wanted to live independently, but she had lived in the same apartment for 70 years. So I'm sure you have that in your, at Jefferson's Ferry, where you try to make the resident as comfortable as possible, and where they can bring some of their comforts of, that they had in their own home. So it's not a huge adjustment.
Absolutely. And that's one of my favorite things about going in to see when we have newer residents move in, because the apartments or the rooms, depending on what level of care you're at, really do end up looking like their homestead. They might be smaller versions, but the photos of family, the trinkets from special trips that they've taken or, from important days in their life are all still there. And I think that's also so important with the memory aspect, to be able to retain some of that. It gives the staff cues and things we can point out and say, oh, wow, who's in this picture with you? Are these your children? Was that you and your husband on your wedding day? And it really helps the resident to feel more comfortable and more at home. And it helps the staff to get to know the person and know what's really important to them.
That's great. I'm glad you brought that up also. So Kim, I wanted to move over to you as well, because I know with your work at Home Care and Good Shepherd Hospice, you work more with, I guess at the end of life stage, or when the patient is getting to a point where you want to make them as comfortable as possible if they're living with an illness or another type of issue that they're having. So my first question for you is, when is the time for people to consider hospice care, and what is the process like when someone is being evaluated for this type of care?
Yeah, good morning, Regina and Ashley and Jennifer. Thanks for having me on this morning and being able to talk a little bit about Good Shepherd Hospice and Catholic Health and also home care. But, I think I'm going to follow on Jennifer's theme, right? We want to make sure that we're not waiting for that crisis. And, COVID has taught us a lot, that people do want to remain independent, like Ashley said, remain at home. And so we often think of hospice as being scary, but a lot of times it's, that window of opportunity to say, mom, dad, my grandmother, my grandfather, what is it that you want? And, should the illness not improve, should the illness be advanced, whether it is a respiratory condition, cardiac, Alzheimer's and dementia, or even cancer. We sometimes only think of hospice and cancer diagnosis, right? But it's truly any advanced illness where mom and dad, they're in and out of the hospital, things are okay, but really not improving. This is the opportunity that, first we want to have this conversation with our physician, right? Is it time? Is this, and often stating, a lot of times this conversation is about, I want to remain at home. I want to remain as, as independent as possible. I want to be surrounded by my loved ones. So starting that conversation, it usually is the family saying to the doctor, mom said, that if she is in a position where, we are not able to improve the illness and there isn't a cure, that she would like to be at home. Do you think it's time for hospice? Because we are thinking about those options. Look into it. Again, I think we get so scared, and I say, if you don't want to do that for yourself, do it for your family, so that we are having these conversations a little bit more in advance, and asking those sometimes difficult questions. But we usually do it together at a time, Regina, with our family, making our wishes known. So important. Again, like Jennifer and Ashley said, we don't want to get into a crisis where I don't know what mom wants. Should she not be able to make decisions for herself?
Right. So it's a collective effort where everybody has to be on board with the decision, more or less. Yeah.
Absolutely. And then what we do is we talk with your physician. We have expert hospice and palliative medicine physicians that work full-time, multiple physicians that work full-time at Good Shepherd Hospice. And we'll talk with that person's primary physician so that we're working together to understand what's happened so far and what can we do collectively together to make sure that our loved one, my loved one, gets the best care possible so that they can have quality of life. Hospice is still about living.
Right. No, I appreciate you highlighting that and clarifying that, and what you had said about cancer diagnosis as well. I mean, that obviously is part of it, but there are other areas that why someone would seek hospice care as well. So I appreciate that you're bringing everything to light during this conversation. So what I wanted to kind of move over to now is, obviously we can't have a healthcare forum without talking about how the COVID-19 has changed the healthcare landscape and elder care from every aspect, whether that's from the legal side, the hospice side, the independent living side. And obviously things are different now than they were 4 or 5 years ago. So I wanted to kick it back over to you, Jennifer, with a question of how has COVID, the pandemic, since, in the last few years, changed the elder law, estates, trust planning landscape? And are people now, because of this, more mindful of estate planning because of the pandemic?
People are 100% more mindful. It has really made a dramatic difference, and for the better, of course, because people are realizing that anyone can be vulnerable at any time. The kind of people that used to want to put their head in the sand, I'm going to live forever, it's never going to happen to me, have now realized that anything can happen anytime, no matter your age or how you comport yourself or how healthy you are, and all of those things. We're all feeling much more vulnerable now. So the flip side, the benefit, if you will, to that has been this recognition that people really need to get their ducks in order, their ducks in line, with estate planning, elder law planning, asset protection planning. And that kind of planning, the kind of planning that I do in my firm, is really for the benefit of the next generation. It's protecting assets for the heirs, the beneficiaries, the kids, whoever the loved ones are. And when it comes to advanced directives, your power of attorney, healthcare proxy, and living will, you're making your decisions, like Kim was talking about. If you're talking about end of life care decisions, do you want to be kept alive with all heroic measures, or if your time has come, should you, let me go? Those kinds of decisions you're making yourself, so your family members don't have to. That's a gift for them. So your kids aren't fighting, or your spouse, or agonizing over what you would want. You're saying now what you would want. That's so important and such a relief to your family members. So it's really, these are tough conversations for sure, but it's a real peace of mind. It's a real relief once you've made them, and you're really helping out your loved ones. So that's really what COVID has done. It's brought all this to the fore. It's helped people realize the absolute importance of these things, taking care of your assets, taking care of your planning, your will. People, I think, now understand that if you don't have a will, New York State provides you with where your money's going to go. And if you don't like it, too bad, because there's a statutory scheme that says this is what's going to happen. And that's it. So if you don't like that, you don't want that, you need to draft your own will. So it's very clear that people need to get on board, and it's been a benefit of COVID.
So, and probably one of the things that you said, Jennifer, obviously it has made more people mindful, even say the younger generation with getting a will together. Like, for example, people, I won't say how old I am, but people who are not seniors, most people probably think, oh, well, I'm only in my 40s or I'm 50. I'm not, 75 years old. I don't need a will. So people, I guess, think everyone thinks it won't happen to me. So that's probably another area where people have said, yeah, maybe I really need to get going with this and I need to speak to an elder law attorney.
Absolutely. And, anyone over the age of 18 should have a healthcare proxy and a living will. Young couples, when they have a child, absolutely should have a will. And anyone with a child with special needs absolutely needs to do a will and a special needs trust within that will or as a standalone trust. So, everyone has different needs, as we were talking about. And I will say, in my firm, we have always provided estate planning benefits as part of our benefits package, but now other companies are. For example, Amazon, they've realized the importance of estate planning for their whole staff members. They're obviously a huge company, and now that's part of their benefits package. So we're seeing other companies start to do that. And we have our own employee benefits package that we provide to large companies. And a lot have signed on for that's for elder law planning, but huge companies have signed on to that. So the importance of this stuff is really catching on largely because of COVID, and also because of people like you, Regina. When you've gone through this with your parents, you get the importance of it. If you haven't gone through it with your parents, you will, or a sibling or another family member, and then you understand the importance of this.
Yeah, no, that's all great information to know. So Ashley, I wanted to move over to you. Similar question, but more within the realm of what you live each day at Jefferson's Ferry. How did the pandemic change the current landscape obviously it has, of the elder community care on Long Island? For example, there was obviously a lot of loneliness for the elderly being isolated during that time with not being able to have, in-person visits or communication. So I'm sure now there's heightened awareness regarding also health and sanitation protocols also as a result.
Absolutely. And a lot of the health and sanitation protocols are ever changing. Just when we think we kind of know what to expect, something new has come out, or there's new variants and things like that we are constantly on top of. We did see an increase in isolation with COVID-19, especially at the beginning of the pandemic when visitation was shut down and people were more isolated and had to stay further apart from other people. I will say, I think, especially within nursing home and assisted living communities, it was also a time where we saw some of the best in our staff and our residents. We saw, people coping with the flexibility of an ever-changing pandemic with such grace. And just the amount of creativity and compassion from our staff to our residents and our residents to our staff. We had people making changes every day. We had staff who would sit bedside with someone if family couldn't be there and we thought we were nearing the end of life. Our recreation department made many modifications to some of the favorite activities that our residents would spend all their time in to make sure that they could still do them in some way, shape, or form. I remember walking onto the unit one morning and there was bingo going on, and everybody was in their doorways apart from each other with masks on, but they were all able to engage and participate in something that they loved. We also saw more embracing technology than we've ever seen, especially with our older generations, because we didn't have much of a choice. So things like video chatting or using hearing assistive devices when you're having a family visit 8 feet apart, 6 feet apart from someone and you can't hear as well, really made them able to still engage in some of those activities and to see the people they loved while maintaining safety.
So it was probably a lot of seniors became more tech savvy too, probably during that time, learning FaceTime and iPads. And so it was, and that's great that you're saying that you were able to try to make it as, normal as possible, even though they couldn't be with their loved ones. They could have still that community feeling, within the facility with games and activities and some of the other things that you talked about.
Yeah, absolutely.
So, and I'm going to actually just pivot on that, talking about, because you both, Jennifer and Ashley, talked about, technology and advancements. So, Kim, I'm going to pivot back to you. And if you can maybe talk about some of the advancements and technologies that are ongoing right now within home care and hospice for patient comfort.
Yes, thank you, Regina. I would say we embraced, the COVID pandemic, and it really did, as Ashley stated, it made us very creative and to continue with that advanced technology. So being able to have a nurse not only come and visit, right, but we can also, on what we have as a telehealth platform within home care, be in that person's home 7 days a week through remote telehealth monitoring. So for example, if your loved one has diabetes or cardiac disease, we have a special iPad that provides instructions and reminders specific to that person's illness. And also, we're using peripherals with Bluetooth technology that gets, it's kind of like Star Trek and beam me up, all this information, blood pressure, levels of oxygen, weights, heart rate, and all of this information goes to our nurses 7 days a week so that we can see those little changes and avoid those unnecessary emergency room visits and hospitalizations. We can also, beam in a physician so we can have a telehealth visit. So, that's really important, understanding that through home health, at Catholic Health and through Good Shepherd Hospice, we're always consulting with our physicians and your physician to make sure that we're following that person's orders, the orders that would support, anything regarding medication changes or, changes in treatment modalities. All of our clinicians have, iPhones, and, we are able to, take pictures on a clinical record, let's say, for example, of a wound, and send it immediately to that person's physician so that they can say, you know what, healing, things are great, or I'd like to make some changes in what you're doing, Kim, as a nurse in the home right now. So we have that real-time ability to help support keeping that person at home. So, everyone has laptops, and like I said, really putting those technology tools in that person's hands, in that person. And we have 95-year-olds using remote telehealth monitoring. So we have technicians that teach and guide and support. And if something goes wrong, send them right back out to help support that process so that person can be at home where they want to be.
That's all really great information. And it sounds like when you're talking about, Kim, about technology, it's not only good for communication with families and the residents, but also for collaboration among that patient. There's probably a few different physicians that they have, whether it's a cardiologist or a urologist, or, and they all need to be in communication and know if there's a change with the patient as well, I would think.
Absolutely, Regina. And, when it comes to the actual services itself, we can do in the home 99% of what a hospital does when it comes to, providing intravenous therapy or any therapy modalities that is often, looked at as advanced, thinking, oh, can we do this at home with equipment and oxygen? So, really making sure that we're providing the services that are needed to keep someone at home and also support them in, an assisted living facility or services within a skilled nursing facility.
Well, that's great, great information. Thank you. I'm going to move it over to Jennifer. We're going to talk about something that always is ever changing, probably by the day, is regulations within elder care. So it's a good thing that we have an elder law attorney here on our panel today to answer some of those or to dispel some of the myths or get us up to date. If there's anyone logged on that might have a question or a concern about regulations. So Jennifer, if you can maybe just share if there's anything new in this area that anyone should be aware of regarding elder care, elder law regulations, as they might be navigating what is best for themselves and or their loved ones.
Sure, absolutely. So you're 100% right. Elder law is constantly changing. New laws are coming out all the time, which makes it a great area to practice in, but not so fun if you're a consumer trying to navigate the elder law system. So what's coming down the pike right now that we are waiting for is a look back period for Medicaid home care benefits. So just to recap this a little bit, there's a 5-year look back for Medicaid nursing home benefits that most people are familiar with. It's that 5-year look back where you have to plan ahead, transfer assets 5 years in advance to preserve all assets. In New York right now, there is no look back for home care benefits, meaning that you can transfer assets today and go on Medicaid home care benefits tomorrow without any kind of penalty period. That has been changed under the law to a 2.5-year look back period, but it hasn't been implemented yet. And that's because of COVID money that the state got from the federal government. That money has to be spent first. So we don't know exactly when this will be implemented, but it seems like it'll be sometime in 2025. So we're kind of holding our breath, waiting for that to happen, but it is coming soon. So if there's anyone out there who is thinking about themselves or their family member needing or loved one needing Medicaid home care benefits, now would be the time to apply and avail themselves of those services before that look back does go into effect.
I know that's always a very important topic, is that look back, and a lot of people probably don't realize that as they're starting to seek out, whether it's an assisted living or a nursing home or another type of care that their loved one might require.
Right, exactly.
So I wanted to move it over to you, Ashley, to another area that obviously or unfortunately affects some of the elder community is long-term chronic conditions such as dementia or Alzheimer's. And I know at Jefferson's Ferry you do have memory care and other types of assistance that you can that can help these folks. So if maybe you can discuss, these conditions, and also does Jefferson's Ferry offer programs for the community, for the internal community, such as music, arts, or how do you work with these folks to make sure that they're comfortable, while they're living with these conditions such as dementia or Alzheimer's?
Absolutely. We're very lucky here at Jefferson Ferry. We're going to be opening a brand new memory support assisted living unit soon. So we're all very excited to start that. We're working on getting all the training done. All of our staff members are becoming certified dementia practitioners, which is just so exciting for me to see come to life. Unfortunately, many of us deal with this with our parents, our grandparents, someone in our family, or someone we care about when they start to have memory difficulties and need that assistance. And I think deciding to place someone in a long-term care setting, whether assisted living or skilled nursing, is probably one of the most challenging decisions we have to go through, minus the end of life decisions as children and grandchildren of these people we love. But we tend to try to remind people, similar to kind of bounce back on our earlier conversations about not doing things in a crisis, not when they plan ahead and we get someone involved in a community and settled in a community when it's not a crisis and it's not an emergency situation, we see people flourish. With the supports in place, their family members and their friends get to go back to just being family members and friends, not being caregivers. We see those relationships become so much better because it's not that stress or that feeling of being a burden on someone else. We oftentimes see that their overall quality of life will improve as well because they don't have those stressors of maintaining their home and keeping track of their medications. They can really dive in and enjoy the community life we have. And here at Jefferson Ferry, we really take the concept of person-centered care to heart. We spend a lot of time with our residents when they first come in and throughout their years here, figuring out what programming, what things do they enjoy? What did they used to do when they were in their 20s and 30s? How did they spend their early retirement years? And then how can we modify those things to be safe and appropriate for them to engage in here? We still take trips out into the community. Our assisted living residents go out to the wineries. They get to do all of these things with the safety and security of knowing there's staff there to assist them. And that when they're ready to go home for the day, there is a bus there to take them back. We have so many different things that come in to the facility, so many entertainers, art therapists. We do music almost every day here. And a lot of our residents really, truly still do educational programs. We have trivia and crosswords on a regular basis, and many of our people are much better at crosswords than my brain could ever be. And then once the weather gets nice, we enjoy going outside. We have so many community spaces where we can garden and just have barbecues and do a lot of fun things that we would normally have to do inside outdoors. And by keeping in touch with what the residents like and dislike, especially as new residents move in, other residents move on to different levels of care, we can really tweak what we're offering to meet what they want.
Well, that sounds great. That it's kind of like when you had mentioned you try to get a feel for what they enjoyed in their younger years, and maybe for especially when you're the memory care patients, that might make them think about time when they were young, and and that might help them remember something, and then they have a great day. So it sounds like that's something that's top of mind where you are.
Absolutely. And even just tying onto that, remembering a lot. Unfortunately, as our memory goes, the longer term memories are the things that stick. So pulling those long-term memories out and being able to really find the positive aspects can improve everyone's quality of life.
Yeah, no, that's great feedback. Thank you. And also another follow-up question, like, for example, do you sometimes get feedback from the residents in different areas of, whether it's the assisted living or the certain sections of Jefferson's Fair and what they would like to do? And I'm sure you take that into consideration as well. If there's something that, hey, we'd like to play bingo or, go on this trip or have this activity.
Absolutely. Our recreation department does such a great job at that. They actually will regularly do surveys with the residents where they'll go around one-on-one and ask them, what activities are you looking for? What things do you enjoy? Is there something you don't enjoy? Where would you like to go on a trip? I know for a while we had residents who were interested in sporting events, like going to a Long Island Ducks game. And as soon as we know about those things, we try to implement and put them in where we can tweak the schedule and make it really meet what they would like to see at their home.
That sounds great. That's always good to put feedback into consideration as well. So Kim, I have another question for you. And I know you had mentioned this earlier with hospice being obviously a sensitive topic for the patient as well as their families and loved ones. If you could maybe discuss some best practices or, real world advice to ensure peace of mind during the patient's time of need for both the patient and for their loved ones as well.
Oh, sure, Regina. First of all, we want to make sure we meet the person who is on hospice and their loved ones together where they are. And it really is about the individual and their loved ones. And at the end, if we had to say, did we do everything right, then it is making sure that, number one, that person is comfortable to the degree they want to be comfortable regarding, their illness, but also for the family that there's absolutely no regrets, right? Like I promised mom that she would stay at home. So we talk about that. We meet the family, we meet that person where they are and what their wishes are, right? So we really do want to know what their wishes are. Everyone thinks, you have to have a do not resuscitate. You must have these advanced directives. That is not the case. It really is. And do we need to discuss that further? So, it's often starting out, if there are no advanced directives, let's make sure we understand. That's a best practice. Your wishes are being carried out. That's our goal. If the goal is to stay at home, then we want to do everything we can with the family, working together with all of our services, nursing, social work, spiritual support, right? Having either a priest or a rabbi or someone from your parish, that is all a part of the hospice benefit, making sure that there's enough aid support. There might be, I often talk about, we provide intermittent aid support, but then that person may have an additional benefit, like Jennifer spoke about, that we can work with, other insurance reimbursement to help make sure that there's enough support, volunteer support for rest, and really giving that caregiver a break. So, I think it really is making sure that we're providing the needed support, guiding, listening, anticipating, like a lot of times anticipating what may happen next. That's the expertise of hospice, right? Making sure that we're working based on that person's illness and their disease trajectory, that we are going to meet them where they are and help with that process. And you know what? Making sure that we are a part of living. A lot of times people think, that's all we're going to talk about, and that's not the case. We're meeting people where they are. We took care of someone recently, and I was on a joint home visit with the nurse and met the family, and this is someone who worked for one of the major broadcasting networks. And, we talked about his life, and we talked about his legacy. And that's another thing we do as Good Shepherd Hospice, is really, making sure that legacy is communicated and even documented, right? So that we can provide that for the children, the grandchildren, after that person has passed.
So it's interesting you had mentioned that, Kim. It's just, it's not always about, a sad time. I mean, while it is, and then, that is the time most people associate, obviously, that emotion with end of life, but it's also preserving their memories and making them, try to, make sure that they're as comfortable as possible and they remember the good times and their family remembers the good times in their life as well.
Absolutely.
Yes. So I think we are about at the end of our discussion, and I know that I've asked all the questions that I have for the three for Ashley, Jennifer, and Kim. So I don't think we have any questions from our live audience, and rather than just hear crickets and everyone stare at me for the next 10 minutes, I have a question for each of you, and we can start with Jennifer, and this is more of sort of like to just as a wrap up. Where do you see the future of elder care and elder law throughout Long Island over the next few years?
I see the future. I mean, healthcare is obviously a booming industry, and our country as a whole, including Long Island, is getting older, is graying. So this is an industry that's going to grow, and we need to be able to accommodate geriatric medicine, healthcare in general, and services along that path. My concern is that people cannot afford long-term health care. They can't afford home care for a long period of time, nursing home care or assisted living for a long period of time, because it's very expensive. And truth be told, I wish that we could be paying the people who are working in these facilities much more than we pay the average home health aide, et cetera. But also the government can't afford it either, because it is so expensive. So I think the future has got to include some kind of cost sharing between people and the government. I don't know what that may look like, but maybe we could be looking at what other countries are doing to support their people in this way. But it's going to be a problem because it's going to explode and expand. So we're going to need something that helps both people and the government provide good quality care for all of us. It's going to be us someday soon. Soon being a relative term for all of us, but it impacts, obviously it's impacting our older family members right now, but it's going to impact us as well. So we're going to have to start very soon solving this problem, because it is a problem, and we're going to have to address it sooner rather than later.
Yeah, and well, it's all about, it sounds like, you having those tough conversations and pre-planning so that you don't end up in a situation during a very, precarious time in someone's life. So
right, but really it's a budget issue for us as a society and our government, and how are we going to solve this? And it's not unique to New York or Long Island. It's a countrywide problem.
Yeah. So Ashley, I don't know, your take, where do you see the future of elder care on Long Island?
I am very hopeful that we'll start to see a return of some kind of normalcy following the ending of the pandemic. And, we're starting to see some leveling off in the number of changes regarding infection control and regulations. Hopefully we can get back to the sense of community and that family feel in facilities that we had prior to the pandemic. We can do the things we used to do, hold these larger family events, and really get back to feeling more like a home and less like an institutional setting.
No, that's very, I really appreciate what you said. I feel like things have slowly gotten back, and I'm sure you've seen that in the community as well. And I'm sure the residents appreciate that, being able to get together with loved ones and just be with people again, because that's so important for the elder community.
Absolutely.
And Kim, if you want to sort of just take us home here and wrap it up.
Absolutely. Thank you. I would say that, I see us in a positive way having these conversations earlier. I see more referrals, and when I say referrals, I mean, that first touch point of coming to our organization for home care, for hospice. It's coming from families, it's coming from physicians, not necessarily the hospitals. But I also see us, and I'm very, very hopeful about community partnerships. It does take a village to make sure that our loved ones can remain independent. And it's all of us, everyone on this panel, everyone in our community, working together to make sure that we can service our elderly and those that need care in a facility or at home, where people, truly want to try to stay as long as possible. So I think we really do have to think outside of the regulations, outside of the reimbursement. We're going to take all of that into play, but, calling on, our grandchildren, right, in between, high school gigs and sports events. And it really is the entire family in our community and our neighborhoods trying to work together to support each other across Long Island.
No, I agree with that 100%. It's really to sort of just wrap it up, it's a collective decision, excuse me, that everyone has to be involved in to make the best decision and choice for their loved one. So I wanted to thank all of you today, Jennifer, Kim, Ashley. This has been a great conversation, and I've enjoyed speaking with the three of you. I've learned a lot for myself and for my own family, and I hope that anyone who's logged in today, came away with some great information and some great best practices as well. So thank you all.
Thank you.
And
Thank you.
you're welcome. We're going to, for anyone who's still on, we're going to take a quick break, and then we're going to meet back for our second panel discussion on mental health advocacy and services at 12:30. And thank you everyone for joining today.
Thank you.
Hi, I'm in.
Welcome back. It is now time to introduce our final panel discussion for the afternoon. This panel discussion will have a strong focus on mental health and mental health services on Long Island. The experts for today I'm about to introduce will share key insights on the growing need for these services as well as advocacy. This afternoon's distinguished panel includes Adrian Lopresti, Executive Director, Yes Community Counseling Center, Kathleen Rivera, Executive Director and CEO for North Shore Child and Family Guidance Center, and Jamie A. Rosen, Partner Chair for the Mental Health Law Group at Meester, Sillig and Fine, PLLC. The moderator for this panel will be Long Island Business News reporter Adina Gann. Everyone welcome, and Adina, I will pass it over to you.
Thanks so much, Regina. And that was a very interesting panel if anybody had a chance to listen to the earlier session on elder law. I know I learned a bit. So I'd like to welcome everyone to our discussion on mental health. And if you just bear with me, I have some stats here that kind of paint a picture as to like where we are with our challenges currently with mental health. I've got some stats that were shared, I believe, by Catholic Health that says there was behavioral needs are increasing. There was a 28.5% increase in drug overdose deaths during a 12-month period ending in April 2021 versus the previous year. And the pandemic exacerbated some of that. And another survey showed that 69% of respondents say that the average wait time for patients was up to 3 months, which kind of exemplifies the high demand for mental health services and a limited supply of the same. And in that same survey, 42% of respondents saw an increase in their patients' length of treatment. So Catholic Health is seeing what they describe as a dramatic increase in behavioral health disorders such as anxiety, alcohol and substance abuse, depression, bipolar disorder, and schizophrenia. So with those insights, let's jump into our discussion. Welcome, everybody. Jamie, let's start with you as a partner at Meester, Sillig and Fine. When would somebody call a mental health attorney for help? And how is it that you work, how do you work effectively to assist your clients or their family members?
Well, first of all, I just want to say thank you for having me here. Really excited to be on the panel here with Kathy and with Adrian. So first of all, thank you. There really is no wrong time to call for help when life seems normal and calm and your friend, your loved one, the person is compliant with treatment. You can plan for an inevitable relapse or some type of crisis so that you are prepared. More often than not, however, I get the call when a mental health crisis is well underway and we start to strategize and advocate immediately. Generally, you should reach out for help when you start to see what we call certain red flags, any psychiatric symptoms, even if they're not rising to the level of a threat yet. Maybe they're not posing a substantial risk of harm to anyone yet. But if the person stops taking their medication, stops seeing their mental health provider, or there's other changes in behavior that you are concerned about, before it turns into a full-fledged crisis or a decompensation, call for help. Before you're forced to call for 911 or mobile crisis team to come to your house unexpectedly, your loved one is rushed to an emergency room, call a lawyer, see what your options are, see how you can plan. To answer your question, how do I work with families? I can give you a few examples. The first relating to hospitalizations, psychiatric hospitalizations. I really help clients navigate all stages of a psychiatric hospitalization, getting a potential patient from their home to a hospital for a psychiatric evaluation, advocating for admission to the hospital, advocacy while in the hospital where they're hopefully getting treatment, and then advocacy for a safe and comprehensive discharge plan. not just here's a prescription, here's a referral to a doctor, and good luck. But for example, I've helped families secure outpatient treatment. It's county by county for assisted outpatient treatment that is court ordered. And I've helped families secure placement in a partial hospital program or deal with housing applications, all as part of the discharge from a hospital. The second way I help families is when someone is so incapacitated and their illness really prevents them from being able to manage their daily living, maybe their financial affairs. I've represented many clients in guardianship proceedings where an individual really cannot manage their personal affairs and their financial affairs. Guardianships are getting a bit of a bad reputation in the media this year with everything going on with some celebrities and what we are hearing about how they were treated underneath their guardianship. But I have found it can be a very effective tool when used appropriately. We've handled many issues and managed many issues through a guardianship proceeding, such as eviction, threats of eviction, or where there already is a pending eviction proceeding due to behaviors on the property. I've helped families manage hoarding issues, safety issues, harassment accusations, and so much more. The third, which is something that Jennifer spoke about on the first panel, is estate planning, because when I have a family coming to me about their mentally ill, individual in their life, the well members of the family really need to make sure their estate plan is in place. Because if that mentally ill individual is a beneficiary or a potential beneficiary of their estate in the future, they really need to make sure a proper plan is in place. Maybe trusts are created to provide for their mentally ill family member in a way that will not disrupt their receipt of benefits, things like that. So those are just a few examples of the ways that I really can work with a family in need.
Thanks so much. I'm sure for families, it's got to be frightening, and to have somebody that understands like the landscape, that's got to be a relief, I would imagine.
Absolutely.
Yeah. So I know we're having some technical difficulties with Kathleen, but hopefully she'll jump back in soon and we'll catch her up. So Adrienne, as the executive director of Yes Counseling, do you find that there's more support, including funding, for addressing mental health issues today? I know there's lots of discussion about, like the states giving more funding. Like, what are you seeing on your end, and is it helping?
Sure. Again, thanks for having me here today as well. Certainly, yes, there is, in response to the growing need, there are more opportunities and initiatives that have come forth in recent years, particularly the last 2 years. The New York State has had many initiatives to expand the system of care really across the continuum, from hospital bed capacities, more rapid admissions, to expand technology, for greater access to use of telehealth platforms, community-based care, and integrated care, so that, with the recognition that co-occurring disorders present in primary healthcare settings. So if someone's going for a medical condition, they may also present with co-occurring mental health challenges or self-medicating and with addiction issues. So we have to be able to respond to the whole person wherever we may be treating them, and across the both medical behavioral health system of care, and understand what those needs are. And so there is certainly more funding opportunities, but with that said, certainly it's probably no surprise that myself as a director of a nonprofit organization, that I would say that our workforce is at risk, and that's been an ongoing conversation due to burnout and the demands in being able to keep up with the needs. And burnout, there are many staff, qualified staff, leaving our workforce and fleeing to the private sector. Primarily, partially due to the expansion of telehealth and opportunities for people to work remotely, that the grassroots and community-based settings are sometimes losing those staff because it's a challenge to provide equitable wages and also keep up with the increased costs that we're all facing. So with that said, while there is increase in funding opportunities, we really are still in a crisis where we are often not adequately staffed. And increased programming is wonderful, but having qualified staff to provide those services is just as important so that we can deliver the outcomes that we want to see. We need people, on the front lines that really have the experience to work well and treat people with great, education and experience.
So does that mean that for a counselor, there's good job opportunities right now?
There are more. There really are more, and a lot of that, as I said, is due to the increase in telehealth. But what we do find is for many with trauma and complex needs, that community-based care, where they have that connection, which has been lost for many, is so important. And while it's convenient to maybe just log on to a session, that connection is not always there, and the dimension of care isn't always there, or the ability to properly identify what the needs are. So those opportunities exist, but then it certainly makes the workforce vulnerable for those the community-based organizations.
Right. Kathleen, I'm glad that we got you back. My question for you is, what do you see as the Executive Director and CEO of North Shore Child and Family Guidance, what are you seeing as the most pressing mental health issues currently?
Yeah, so I think I may be piggybacking off of what Adrian said, lack of access and affordability. So the financial barriers to mental health treatment is not a new challenge, it's an ongoing challenge, which basically means, the Band-Aids we've been putting on it hasn't fixed it. So you've got folks out there that have insurance, but unfortunately there's a lack of parity within insurance plans. So you have insurance, but you don't have enough providers either accepting the insurance that you have, or concurrently, you have insurance and you have a wealth of mental health professionals that can take your insurance, but they have waiting lists, right? So it's called network capacity issues. So you can find 50, healthcare professionals, mental health care professionals in your area. You call all 50 and they have wait lists. And we know with mental health issues, while they may, depending on where they are, start off small, right? We know the longer it goes untreated, it grows bigger. The challenges. Going back to the workforce that Adrian had referenced, diversity in our workforce. There are not a lot of clinicians of color, and we treat everyone, and children and families in particular that we work with, it's important to look like the communities that we serve. And this is a field that traditionally is not always met with communities of color, right? I think there's a lot of stigma behind it. I mean, as an Asian American, this is not a field that you find many people across the Asian American communities entering, yet there's definitely a need amongst the community. So there's this kind of, uneven surface of need, and those who are able to meet that need are not where we need it to be, right? We're seeing younger and younger clinicians with a limited amount of life experience and experience in this field, and yet with the challenges of social media, the residual effects of the pandemic, financial stress, social injustice, the list goes on, the level of intensity of mental health needs, I think, are even greater. And then I think that with the impact of telehealth, there are these AI chatbots that are out there, right? When we talk about data, more and more providers are providing telehealth, which is a great thing. I'm not here to bash telehealth, but we have to be careful and we have to keep a pulse on it. Moving from 39% of providers providing telehealth in 2019 to 88% in 2022 is a huge leap. And if it's not done right, we could be doing more harm than good. You've got these pop-up clinics that offer telehealth only, but they're very selective on who they admit. And so you've got nonprofits like ourselves, grassroots, that are taking kids that have higher risk behaviors, requiring that personal social interaction, that in-person interaction, and the little kids. We're a child-serving mental health organization. A little kid with ADHD or neurodivergent issues is not going to sit in front of a screen for an hour and talk about their challenges and get help. So these are things that I see are sort of, things we kind of really need to pay close attention to.
Right. So are there efforts to try to get more people of color into the field?
Yes. So we are very thoughtful about, our pay scale in terms of those who are bilingual, those, we work with local mosques, right? And we encourage them, or local synagogues. And, we really try to encourage communities of color to move into this sector. So we take a lot of interns, even on a bachelor's level, to say, look, this is work you might be interested in. And we try to really encourage them and sort of see the value in this. While it's not enough time passed for me to tell you if it's been fruitful or not, it's something that's sort of in the forefront of our minds.
Okay, that's encouraging. So Jamie, in terms of legal support, do you find that there's more resources that we need? Like what's missing?
So Long Island is actually home to several different legal aid organizations that provide legal services to individuals who meet certain criteria. And usually it's income and asset eligibility requirements to be able to take advantage of those resources. The legal landscape in New York is really complex in terms of our mental health and mental hygiene laws. It's really important for individuals, their family members, friends, their caregivers to understand how to access legal representation and legal resources on Long Island. So, for example, agencies like NILAG or Nassau-Suffolk Legal Services or different legal aid societies, pro bono projects through the bar associations in Nassau or Suffolk County. They all have incredible programs and resources for civil matters, criminal matters, applying for benefits, managing insurance issues, housing issues, and so much more. However, the individual who is suffering from a mental health condition, in order to really be able to access these services and take advantage of the legal advocacy and support being offered, they have to have a level of insight and understanding that they need help, and they have to be willing to accept assistance. So this is a huge barrier to accessing legal support. A lack of insight into their illness and an inability to understand the consequences of that illness often prevents an individual from seeking help or accepting help that a family member may be trying to help them find. What I see missing is really the legal support for the family. That's really what I do. So these agencies have wonderful programs, but we need a lot of support and advocacy and representation for the family members and the caregivers of these individuals, so that when their ill family member refuses to accept help, what does the family do? The family often won't meet income or asset requirements for free legal counsel or pro bono projects. There's issues where, the family can't authorize these agencies to act on their loved one's behalf without their consent and without their cooperation. So there's issues of privacy, of protected health information under the HIPAA laws that would prevent a family member from accessing information about their mental health care, or something else that ties the hands of the agency or the family. So families will hire private counsel to help them navigate the system and figure out the interaction of the legal system with the clinical system to ensure their loved one gets the treatment they need or the benefits they're entitled to.
It sounds, I feel like I'm reiterating what I said before, but in speaking with you, it just seems that, when the person has the biggest set of challenges, they're also met with all these complexities that they've never encountered before, and probably I'm sure there must be like bureaucracy too of you need this authorization or that form, or so are you like working to or how do you get in front of these families that might not even know that there is the support?
Well, I can give you an example that I worked with a family, and we were successful in getting their loved one to come around and accept assistance. And we were successful in, submitting an application through the county for, SPOA, which is, for housing and all of the benefits and services that he was entitled to take advantage of, so that he wasn't homeless and so that he had a place to live with the services that he needed. And it takes real creative problem solving to help families access the resources available. The wait list for housing is a whole other issue, and the lack of housing available at all different levels of need is a whole other issue. And I know that the governor has a comprehensive plan to overhaul New York's mental health system, and it's certainly a much needed step in the right direction. She's promising to expand and fund outpatient programs and address the shortcomings of hospital admissions and discharge planning. She also promises to fund the creation of supportive or supervised housing. So there is promise out there, and there is hope out there. Yeah.
Right. Okay. Well, that's also encouraging. Adrian, looking at the stats that I presented earlier from Catholic Health pre-COVID, how would you compare the need for mental health services currently? Are we still feeling, I've heard just from teachers saying what's going on in the school, like the cohort of kids that went through COVID and the parents too, everyone, myself included, just what we went through, and now it's like behind us, but like, are we still feeling any kind of residual impact, or maybe we're not even aware of it in a post-COVID world? What are your thoughts on that?
Sure. I think early on we anticipated that, but we weren't sure. And we know that sometimes things take time for us to be able to make those connections. And no doubt, of course, we know the pandemic disrupted routines and connections and a sense of purpose that we all had for extended periods of time. Essentially everybody's focus and behavior had to change for long periods of time, and that has an impact, especially for those with pre-existing factors. So many individuals that were in long-standing recovery relapsed, and those who we know may tend to be more anxious or avoidant struggle to go back to their transition back to their life, because really when you think about it, it was at least 3 years where there were still some modifications occurring, and then people were able to their thresholds were decreased, their anxiety increased, and then they became more avoidant, and maybe were able to avoid for some time because of some of the modifications that still existed. And some have never been able to rebound or reach their baseline before COVID. Those that maybe were depressed and struggled to reestablish the routines that they had previously, or maybe they continued to work remotely, or didn't engage in the activities that they did prior, didn't know how to get back into them. All of those effects continue to play out, and along with the delays that in some people getting care, they figured out, this isn't urgent, I can wait. So they weren't really that early intervention mentality, and issues got worse. So we are seeing more struggling, more with the need, more inability for kids to regulate that maybe didn't reach those milestones, and more individuals with more chronic, profound, severe symptoms that perhaps if there was an earlier intervention, or they had those protective factors in place over the course of those years, they wouldn't be struggling as much.
Well, this seems like a perfect segue for Kathleen. What do you see as the risk of not addressing these issues, especially probably during COVID? They got, you had a problem with your family. Well, you're in lockdown with your family, so it didn't get better probably.
Yeah, no, it actually is good. It's a perfect segue. So I referenced earlier, let's put aside mental health for just a moment. We know symptoms in general, especially medical symptoms, when they are left untreated for extended periods of time, what happens? They get bigger, and when they get bigger, they get more expensive. So, we're a child serving organization. My lens is, when you don't invest in children, the result will be sicker, costlier adults. So we need to invest in them, and I was happy to see that Governor Hochul has a lens on that. Unaddressed unaddressed mental health needs, right? What happens when you don't address it? It puts the body under significant stress. It leads to other medical concerns that we often see in adults: the high blood pressure, the diabetes, the heart disease. And if it's a mental health issue that's untreated, it could grow into a more serious mental health challenge that can become life-threatening, like self-injurious behaviors, suicidal thinking and planning, eating disorders. I think that there's, the list can go on and on. There's a reason the data tells us that suicide remains the second leading cause of death in people ages 10 to 24. Now think about that time frame. 10 to 24 is when individuals are beginning their lives. It shouldn't be the time that they are contemplating ending their life. So we need to treat these issues like we do medical issues, right? When you have a medical condition, there's a 3 C's. You catch it, you check it, you change it, right? You catch it as early as possible, you constantly monitor it, and you change it from progressing, you intervene from it progressing into bigger and more dangerous things. So I think that sort of encompasses the risk. If you think about, addressing mental health challenges from a business model, if you put the upstream investment in it now, it's the long-term prevention. And what it's going to do, it's going to allow us to sustain a healthier economy and, quite honestly, a healthier healthcare system. When people have their emotional and mental well-being in a good place, they thrive. And we know that. They thrive in all domains of their life, in personal relationships, employment, education, and it allows them to contribute to their communities in a more positive way.
So there are societal benefits in addressing it early.
Absolutely.
Yeah. Jamie, why do you think it's, I think you kind of touched on this a little bit, but why do you think it's so difficult for the mental health community to find legal support?
It's true. And I think the question is even broader. Why is it so difficult to find support in general for mental health issues, including legal support? One, there's a lot of misinformation out there. People don't always think about calling a mental health lawyer for help. But when it comes to psychiatry, really the legal system and the clinical system are so intertwined. So a lot of what I do is educating people, educating clients, and empowering the family members to advocate for their loved ones. So for example, I will counsel a client on, what does HIPAA even mean? What are HIPAA rights? Because their immediate gut reaction is, well, the doctors won't talk to me, or they won't give me information. They won't, I have no idea what's going on with my loved one who's in the hospital, for example. So, I'll explain to them what their loved one's rights are. And there are real restrictions on a hospital's ability to share information, but there are also creative solutions here where we will advocate to provide information to a hospital, to a treating psychiatrist and the entire treatment team, and say, this is the history. This is, the diagnosis, the medications that worked in the past, medications that didn't work, and really provide the hospital with information, even if they can't share information in return. I also counsel clients on their rights, maybe as an agent under a healthcare proxy, or sometimes their rights as a court-appointed guardian. There's also a lot of stigma when it comes to serious mental illness, and that is also a barrier to accessing care and accessing legal support. So as Adrian was saying, people are delaying seeking care. And as Kathy was saying, we're leaving symptoms untreated for an extended period of time until a crisis happens. But it doesn't have to be that way. I will say, we're starting to move towards more acceptance. We see it in the workplace with many major companies trying to implement workplace mental health initiatives. We've seen major athletes talk openly about the importance of mental health. Naomi Osaka came out in the tennis world about the importance of mental health. Simone Biles in gymnastics has come out about the importance of prioritizing her mental health. It is making headlines in a positive way, mental health issues and serious mental illness. We really need to use this momentum to effectuate change. And so I think we are headed in the right direction, while there is still stigma for serious mental illness. I do see a trend towards more acceptance, or at least more awareness of the importance of mental health.
Right. You're reminding me of Simone Biles. She kind of changed the narrative, right? Like, she didn't care. She was like, it's not, she was right, because, my goodness, what if she went and competed and then injured herself, or, she really took care of herself. And then she went off to, do such amazing, inspiring things. Adrian, how do you think you go about, or are there things we can do here on Long Island to help remove the negative stigma about mental health?
Sure. Well, similar to what or piggybacking on what Kathy was saying earlier, and Jamie, it's really about working together across all sectors in our community so that we are using universal language that normalizes mental health, wellness, and that being a dimension of our being and our humanity, that we have this continuum of mood and functioning that fluctuates over a course of a lifetime, and we are all, as human beings, vulnerable and have risk factors, due to our family history or transitions or losses and physiological changes that we experience at different times in our life. That's a part of being a human being, just like our physical health. And being able to change that narrative so that, we don't view physical health and mental health differently, but they're interwoven, and, preventative measures that we take for our physical health and self-care. It's the same is true for mental health. It's not about being weak. It's about being human, and and needing to recognize we all have risk factors. So, across the sectors, so that whether somebody's walking into the post office or the front desk at a doctor's office, that everyone essentially can view mental health as something that impacts us all. Social media, wherever in schools, wherever people are interface, we need to be able to have these conversations and normalize them. I had a conversation the other day with someone who owns a local business, and I asked him how he was doing, and he had recently experienced a very difficult loss, and he said, "I'm doing okay, and I'm in counseling now, and it's helping me, and I tell everybody now so that people know it's okay to get help." And that's just an example of, he's a business person who encounters people in a very different realm than we might, but not everybody may come to our setting for help. They may just present as needing some support or validation in anywhere in our society. So partnering and for programs to work with all sectors in business and healthcare and government and law enforcement, religious institutions, we have to come together to take a look at how we change that language and normalize in our communities that we need support, and we all have mental health to both manage and support, and sometimes that needs intervention.
Yeah, it does seem like the younger generations are much more open about it, and like a given that they're getting a support. Kathleen, how does your guidance center work to support clients, and do you have any success stories or best practices that you can offer?
Yes, I have all three.
Okay.
So, we often say at the Guidance Center, we're a family that treats families. You don't treat a child in a vacuum. They're usually attached, right, with the support system. So every family that walks through that door is connected with a family advocate or offered a family advocate. And so these are caregivers and parents. A family advocate is someone who has personal experience with mental health needs or has received services for themselves or family members, many times their children. So right off the bat, we offer that to them the minute they walk through that door, because it can be very scary and they're coming in vulnerable. We also provide another best practice that we have is we provide trauma training for all of our staff on all levels. So you don't need to be a clinician, and we make it mandatory because it creates this level of understanding and empathy of what a family is going through. And it allows us to provide care and customer service through a trauma-informed lens. So while we all are not clinicians, we all do social work, right? That's kind of the way we see it. Another best practice that we like to do, and my colleagues touched upon it, is collaborative partnerships. I would be crazy if I thought my agency could do it all for a family. Absolutely not. There are gaps in care. And so I know that I need to partner with the right organizations to make sure my family doesn't fall through the cracks. And I don't say, here's a number, go call this person. I can actually pick up the phone, call someone else and say, hey, I'm sending this family over to you for, to access your food pantry. Please help them. Their name is so-and-so. So, making sure that an organization, our organization, has solid collaborative partnerships that meets the needs of the families is paramount. And, last, I'll leave you with a quick success story. So, our motto is also looking at a wraparound approach to care. So we don't just say, oh, this is one symptom they need. We'll provide them with this one service and sort of put our blinders on for the others. We leverage every service that we have within our network and obviously with those that we partner with. So a quick success story is, obviously the names are changed, but Sally is a mom of a teenage son named John. John was a school avoidant struggling with school avoidance, violence in the home, depression, and use of substances, mainly cannabis and some alcohol. Mom ended up having a child protective case called in because of his truancy. So that was an added stressor placed on the family. With the help of the family advocates that I had referenced earlier that we offer every family walking through the door, they held her hand every step of the way. They were knowledgeable about the system, and they were able to work very closely with the school to put some extra services in place. They worked with the local Department of Social Services to have the case dismissed. While this was all happening, we were putting services in the home. We knew John wasn't going to come to us. If he was school avoidant, he certainly was going to come to our clinics. So we wrapped our services around him and went to the home. So we had the psychiatric services, the mental health services, and we put him in touch with a peer recovery advocate who helped him with his sobriety journey. We also then, when he was feeling a little bit more confident, we enrolled him in our wilderness respite program, which was every other Saturday. So John got a break from mom. Mom got a break from John. They got to re-energize themselves and sort of come back together as a family unit, which is really important. You need those breaks. It can't just be on a loop, right, of stress, chronic stress. John actually ended up losing a little weight going on our wilderness respite programs. And so he ended up joining a gym and started to really gain the confidence in himself. And so I'm proud to say he's back in school. He's actively engaged in his substance use services and continues to go to the gym. And their family relationship has been phenomenal to watch.
So, and you're giving them the like here, go, rather than having to figure it out themselves, which is
you give them the training wheels, and then you take them off, and you say, "Okay, go." Right? We'll be a safety net for you, but you need to try this on your own as well.
That's awesome. So we're running out of time, but I did have one last question that maybe you could each address, and we'll start with you, Jamie. What immediate changes can we expect in the mental health field, I guess, right now and in the years ahead? What do you see in the pipeline?
I think the changes we are seeing are awareness and acceptance. Like I said earlier, many important people are coming forward and raising awareness in the media about the importance of mental health and well-being. And I really like what both Adrian and Kathy said in terms of working collaboratively, because really, as a lawyer, I need to work as part of a team with mental health professionals, with agencies, with organizations, and with the family and with the individual who is suffering to really make a positive impact. And having those collaborative partnerships and knowing where to find the resources that families can take advantage of is really crucial to the success of my practice. What I wanted to end on is May is Mental Health Awareness Month, and we are going to be seeing this topic widely publicized over the next month. And what our job really is, and what I see my job is to make sure that once May is over, the conversations continue, the fundraising continues, the advocacy doesn't end. And I do speak on these issues year round and publish articles on them and really try to keep the topic relevant all year round, because this 1 month is a great way to raise awareness, but really these issues are important year round, and they're part of my practice all year round.
That's great. Thank you. Adrian, what about you?
Well, Jamie certainly said it all, but just piggybacking on that, certainly, I think just hopefully innovation, that we all have to be willing to think and work out of the box if we're going to help people get well, and do it by working together, and not being afraid to move a little bit away from our traditional approach and use common sense to how we help people, and considering the hierarchy of needs. As Kathy's dynamic program, sometimes we have to give people concrete tools to be able to do well before we can start helping them think about the underlying stressors, if they're worrying about food or their physical health or their housing. So looking at people as a whole, and hopefully more of a preventative approach, so that as I had said earlier, that it's not just we don't pathologize everybody who's struggling, but understand that especially in the world that kids are living today, that the tools to regulate and the ways in which family connect, they're not as easily just naturally available in the environment. So we may need to impart some other ways, find places in our life to make sure that those tools are being developed in our kids, and that those connections, important connections between family, is happening in the crazy pace of our lives.
Kathy, what about you?
Yeah, I'll keep it quick. So I think, just piggybacking of acceptance and awareness, I know Jamie's referenced it, and so is Adrian. I think the collective trauma of the pandemic, even though it's in the rearview mirror, made us realize no one was immune. So that vulnerability of everyone has really opened our eyes. Just to be clear, mental health has always been a huge issue. We've just now really felt comfortable talking about it. So I just want to make sure I clarify that. Can't be said enough. We had our blinders on. And just, I think also what we're going to see is a proactive preventive approach. We're going to see more screenings and interventions before it becomes an actual crisis. As has been mentioned before, the 2025 New York State budget is putting intense amount of investments in school-based mental health, broader screenings, mental health screenings in medical settings. So when you go and have your annual physical, it's more than just a depression scale set of questions. It's much more thorough, with the understanding that they may have to attach you to someone else depending on your responses, and the level of mental health care in hospitals, right? Particularly for children and adults, I think is there's more investment being made there. So.
Well, I want to thank all three of you, Adrian, Jamie, and Kathy. Hopefully we enlightened our audience and let them know that there is support, and your insights, I'm sure, will go a long way. So thank you again for joining the panel. And Regina, I'm going to turn it back to you.
So I just wanted to thank everyone today for taking the time out of your schedules to listen in and be a part of these interesting and informative conversations. And a huge thank you to our event sponsors who made today's event possible. Our presenting sponsor, Catholic Health, and our advocate sponsor, Kona Elder Law, PLLC. And I'd like to say one last thank you to all of you who attended our event today to listen, to be a part of these important healthcare topics. Enjoy the rest of your day.